So we're 1 week from surgery.
2 weeks.
Oh, 2 weeks. 2
2
weeks.
weeks.
That's right. We just stitched this out. It's 2 weeks from surgery, and it's not your first rodeo. So
No,
you've
it's not.
had obviously previous procedures. How has this process been?
Amazing. I have to say, I mean, the thighs were a little difficult, but amazing. I feel great. I'm driving. I'm back to work.
Good.
I feel-
That's pretty quick.
I-
Compared to previous operations, is this kind of the way you heal, or is it a little longer than you'd normally take, a little shorter? What's your feeling?
No, I think this time was shorter.
Good.
Actually, I feel the first 3 days were tough, and after that, it's been a breeze.
Well, there's definitely a difference sometimes in the second time around when you know what's coming. You're a little bit more prepared, and hopefully things continue smoothly and you just get better and better. How do you feel about the changes? Because you had already had both these operations before, the thighs and the breasts, and now we've kind of tuned both of them up. So what's your feeling and
I
how
am
things are going?
extremely happy. I
Good.
mean, extremely with my thighs and with my breasts. I feel like I have breasts again.
Yeah. Well, what you had as a
It's
result the
horrible.
first time, well, it lacked a lot of the features that you want to see, and it didn't go well. So now I agree. Now you have breasts again.
I do.
Still, we talked about the one little spot we want to try and improve, because there's always room for improvement. We're always looking at the results critically and trying to make it better. And all in all, I'd say you're doing really well.
Thank you. I'm very happy, doctor.
I am too. I'm hard to please when it comes to this. And so we're looking to the horizon. I'm going to see you again in about probably about 2-3 weeks for this, but we're discussing maybe something new.
For sure. I'm
All right.
definitely looking to do more.
Well, well, we'll see. I know that someone's happy when they're thinking, what's the next thing that we can do? But I'm always telling patients, I take care of one patient at a time, and let's get through this process first.
True.
So we're almost there. What do you think made the difference for you? Having the first operation for these areas and then coming back, where do you see the differences? Other than I know the results, things look better than they did before, but what do you think made that transition for you? What made the difference in this process?
Well, I think that the fact of the matter is that when my thighs were just as everyone has seen, I had a lot of skin, I had excess skin, and now they're completely smooth like they were never before, even with my first surgery, which was a lot.
Wow.
I mean, and the same thing with the breast.
Yeah, well, great. I think, just addressing the problems that are there. And of course, the second time around, it's a little different because things have already been done. And there's good and bad with that. You guys have seen me do a lot of revision surgery. And revision surgery is sometimes easier because, patient's been through it before, you know what you're getting into, you know what the recovery is going to be like, so the process gets a little easier. But it's always more challenging surgically because my hands are tied based on whatever was done before. A lot of times, we talked about this with you, we didn't really know technique that was used for sure, and I wanted to be safe about blood supply. So it makes me have to operate through maybe an approach that I don't usually use, or prefer not to,
Makes
frankly.
it difficult for you too.
Well, it's a challenge. Makes it a challenge, and I like a challenge. And things worked out pretty well. So we'll see you again in 3 weeks, and we'll just follow this process. Is there anything, what is your takeaway? Someone watching this and maybe had a rough go the first time, is not happy with how things have turned out for them.
Well, the way I see it is that it could be fixed. If you come to Dr. Rubinstein, it could definitely be fixed, for sure.
I think most things can be improved, whether you come to me or not. The thing to know is that there's hope.
There is hope.
And I remember when we had our consultation, you were really kind of at your wit's end. You were just kind of almost throwing in the towel, like, well, take a look. I don't know if you can do anything for me. We got to do something. And just really despondent.
I was like very discouraged. I'm like, maybe there's really no hope, because I had seen other doctors and they really hadn't given me any hope. And the minute I walked in here, you gave me hope, and I see the results. I'm very happy.
And I'm glad you are. If you've had a rough go, just know, our patient shared it with you and you've seen it before. There really is hope. We can make almost anything better. So, and not when I say we, I don't mean me. I mean plastic surgeons can make almost anything better. A well-trained, experienced plastic surgeon can take a look at you. If you've had a rough outcome, almost anything can be made a lot better. So if you're feeling like you're disappointed with a previous procedure or kind of down on the way things look, go talk to a doctor or two, and chances are things can be improved. I'm glad we were able to improve things for you.
Doc.
And we've got another appointment coming in about 3 weeks.
Yes, we do.
Okay.
Thank you.